healthcare resource utilization and associated costs among patients with Atherosclerotic Cardiovascular Disease in Alberta, Canada, presented at the Canadian Cardiovascular Congress, October 21st through the 24th, 2020. Atherosclerotic Cardiovascular Disease, or ASCVD, is one of the leading causes of morbidity and mortality in Canada and has a substantial financial burden on the healthcare system. This study set out to examine the healthcare resource utilization and associated costs of patients with ASCVD. Subgroups of ASCVD diagnosis conditions were also investigated, as well as changes in healthcare utilization following ASCVD. We included data from patients identified with ASCVD from administrative databases in Alberta, Canada, between August 1, 2012 through March 31, 2016, in addition to 2 years of pre-index data and 2 years of follow-up data. Patients were identified with ASCVD using ICD-9-CM and ICD-10-CA codes from published algorithms. Diagnosis conditions of ASCVD that were subgroups of interest included patients with acute myocardial infarction, peripheral arterial disease, or cerebrovascular disease. We identified 198,573 patients with ASCVD in Alberta, Canada. Of these, 9,465 were categorized as having acute myocardial infarction, 6,453 had peripheral arterial disease, and 25,617 had cerebrovascular disease, or stroke, as their ASCVD diagnosis condition. The mean age was 63.9 years, and 43.4% were female. When examining the 4 years of follow-up after the ASCVD index event, healthcare resource utilization decreased after the first year, while the largest decrease was observed between the first and second years of follow-up. Healthcare resource utilization and associated costs continued to decrease slightly across years 3 and 4. Interestingly, hospital length of stay, the number of lipid-lowering therapy prescription dispenses, and LDL-C tests remained relatively stable across all years of follow-up. Patients with acute myocardial infarction had the highest healthcare resource utilization among the 3 subgroups. The trend in reduced healthcare resource utilization was also observed in this subgroup, with the largest reduction taking place between the first and second years of follow-up. Hospitalizations accounted for the highest proportion of healthcare resource utilization among all ASCVD subgroups. Among the subgroups, peripheral arterial disease had lower hospitalizations, lipid-lowering therapy prescription dispenses, LDL-C lab tests, and diagnostic imaging tests. Conclusions. Hospitalization accounted for the highest rates of healthcare resource utilization and associated costs in each year of follow-up. Healthcare resource utilization and associated costs were the highest in the first year post-ASCVD diagnosis and substantially decreased in subsequent years. Among the subgroups of interest, acute myocardial infarction, peripheral arterial disease, and cerebrovascular disease, or stroke, patients with acute myocardial infarction had the highest healthcare resource utilization and associated costs. This study is based on data provided by Alberta Health, and the study was supported with funding from Amgen.